I wanted to be a physician of some type, but I didn't know which type for sure. And as I started spending time with different doctors, which was required in my pre-medical program, I spent time with an oral surgeon, a dentist, and some physicians, and I thought I wanted to be a dentist for sure at that point in time. I have a strong oral surgery background. I taught in oral surgery for 18 years at the dental school. But by and large, I love the whole spectrum of general dentistry, which is what I do to this day. Everything's different. Technology keeps evolving. It's more fun every year. We have an amazing team of people I get to work with. Patients they're just wonderful. We have a great practice. I think that's actually a lot of patients that seek our help. And sometimes it's just one problem, but a lot of times people who come to see us are fearful. So obviously we do sedation dentistry, which is IV sedation in our practice, but we can go to a surgery center or a hospital setting if the medical necessity needs to go that far. But really the whole intention is to meet them where they are, recognize that a lot of times it's just their upbringing. They didn't have the financial means to start off, so they're trying to play catch up in their adult years. That happens literally every week within our practice. And it's a privilege to kind of meet them where they are and then take them step by step to get them healthy from an oral perspective. It's exciting to watch their personal self-esteem rise as their oral health care rises, because most of the times they're in better shape than what they really believe they are. That happens the vast majority of the time. Every patient knew probably that their oral health care is a direct reflection of their overall systemic health. It's impossible to have one without the other. So when that being said, today's technology is great as far as imaging, the things that we can see now that we couldn't see before. If you compare it to cardiac medicine, look at the imaging for the human heart, it's absolutely fantastic, from calcium scores to that type of imaging. And dentistry, if you relate it over, we have, CBCTs, we have iTero scans that can actually see inside of the tooth these days. Things that you couldn't even believe were possible 10 years ago, now are just an everyday reality. Very different. So when it comes to quality, that doesn't change. It's always excellence. We try to deliver that. That's kind of been our slogan since day one, and I've been doing this 25 years, so we don't really compromise in that regard. So I give patients options just to let them build their oral health. It's up to them to accept responsibility for what they choose is best for them. I'm not in any way, I don't take control of that. It's really just trying to meet the patient where they are. It's like everyone has a step one. We just try to get them going in the right direction, and hopefully we can get them to their overall oral health needs are met and hopefully exceeded. That's our overall goal. So it's really just a step-by-step process. Everyone has different financial backgrounds and needs, and because of that, we have to tailor our treatment plans for what the patient actually needs to have happen at different stages of their life or in those moments. Often you get the dads who have put their kids through school or whatever it is, like, okay, now it's my turn. So it's like they come in and that's kind of their thinking as far as like their time to step up and be taken care of. Other times it's just one little small thing at a time to get the patient back to oral health. Often pain has to be addressed first, and then we just move on through the process of reclaiming their oral health for them. We have an extremely high retention rate of patients, and we have an extremely high rate of acceptance because we listen to what our patients need. It's not something like, this is in my best interest. It has nothing to do with that. The way we approach treatment planning is, what is it that you would like to achieve? And then what are the oral healthcare steps we need to do to get you there? Sometimes it's surgical, sometimes it's periodontal, sometimes there's a combination of different things that go into that. But ultimately, it's the same process that's involved, and the patient has to be intimately involved in those choices. Once that they are the ones that's guiding that conversation, and we can kind of tailor along with them to show that it works, then the treatment plan is accepted on both sides because it takes two of us, and then we walk that road together. And once they start, they really have already committed at that point to getting back to proper oral health and restoring themselves the way they need to be. It's very rewarding. I had a little girl that came into the office, and she literally had been to nearly every neurologic specialist across the country. She suffered and suffered and suffered, and it was something so stupid as an abscessed tooth that was overlooked. And that girl had been through Mayo Clinic and several other major institutions trying to find what was wrong with her. And it was something so simple as a tooth. And she wrote me a letter last year just thanking me again when she was in. Things like that are just really rewarding as a dentist. They truly are. They really are. It's like, it's one of those items where, parents, and having gone through serious illnesses with my children, they're trying to do what's best for their child. So they're listening to these different people, and whenever you go somewhere, you're just kind of ruling out problems. And sometimes dentistry is overlooked in the medical world. I'm not saying it's intentional, but it can be overlooked, and it can have a major impact in someone's health and well-being. That's why we enjoy doing what we get to do at our office, and just like most dentists get to enjoy. It's really quite a rewarding profession. My biggest hope for each person, well, first of all, they feel comfortable. The most important thing about choosing an office is to feel comfortable with your providers. It doesn't matter if it's dentistry or a medical provider or any healthcare provider. You have to feel like that person is working in your best interests solely, and then helping to educate you as you move through that process. If you don't have that, then everything else that comes after it is kind of, luck in some circumstance if it works out in a favorable setting. But if you know that and trust that your providers, it makes such a difference, whether it's something serious like a cancer diagnosis or something so minor as needing a filling, you want to know and trust your providers. And to me, that's probably the most important thing that I could ask for any patient who walks into our doors or any doors of any office. We get a high number of referrals. I mean, that's really is probably the thing that's probably the most amazing. We started this practice 25 years ago. I started it at that time with not a single patient, and we now have the largest practice in town, and this town has a lot of dentists. So I think that we've done some things well over the years, and I think that part of that has to be how we treat patients and the simple fact that we meet them where they are, and we just keep moving them towards good oral health, and they refer their friends and family. I mean, we really, until we started doing this video, we haven't advertised at all in 25 years.